I'm delighted to be speaking with Professor Valter Longo, whose work I've been following for a while. Walter, it's a real pleasure and privilege to be speaking to you. Hello.
My pleasure, my pleasure. Great to be here.
And where are you just at the moment in the world?
I'm in Los Angeles.
Great, in the warmth of Los Angeles. Great. So, I just want to kick off with a question about why does integrative medicine matter to you?
I think integrative medicine is the future of medicine. I don't think there's going to be just medicine very soon, right? Probably in the next 5 to 10 years. I think integrative has to be the way to go, and just because it puts it all together, right? With the drugs and all the other medical practices with everything else. And a few years ago, somebody was telling me that 60 or 70% of cancer patients, once they are diagnosed with cancer, they will Google the integrative interventions, right? Uh, is that what we want? Obviously not, right? So then we have to have a real field that puts it all together and gets rid of a lot of the quackery and a lot of the alternative practices that may not be backed up by science and clinical evidence.
And I've loved watching your science emerge, and we're going to dive into that. And we are going to talk about fasting in cancer and some of the science. But let's just wind back a little bit, because actually you're the professor of longevity studies. And I wanted our reader and listener to really understand, how you got into this whole piece of research and science.
Yeah, that's all I've ever done, right? So I started. I think my first year in college, I studied jazz performance in Texas, and then my second year, I thought I want to study aging, and so I went from music and never taken a course in biology, and switched to biochemistry. And I still remember the head of biochemistry department said, you're never gonna make it. You're a music student. In a couple of months you'll be running. But that was not the case. So I got a degree in biochemistry, and that's all I've ever done. And then I was lucky to work with Roy Walford first at UCLA. He was a medical doctor, very much integrative medicine doctor, one of the very few in the world at the time. And in the early 90s, Roy was a little bit of an outcast. He was viewed by the School of Medicine, UCLA School of Medicine, as a little bit of a crazy character. But he ended up really having a tremendous influence in the field of aging. We're coming up with studying calorie restriction in people and animals, and he became really the leading figure in the world for aging and nutrition and let's say integrative interventions. Yeah.
Yeah. And I think, this key thing about how we fast safely. I'm living proof of reversing metabolic syndrome using your fasting mimicking diet, having been someone who couldn't go 2 hours without feeling a bit faint without food. So it's such a practical application, going to make such a difference, I believe, to people. Just understanding that until you can switch insulin off, you will not lose weight, even if your diet is healthy. Some of the science that's coming in it is incredible. Um, there are criticisms around the fasting mimicking diet, and it would be great for you, as the person who led in the development, to explain a little bit about fasting and its benefits, and then why the fasting mimicking diet makes it so practical for the everyday person to explore.
Yeah, so I would say that, not surprisingly, right? If we think about fasting and we just say, is fasting good or bad? I would say that it's mostly bad, right? So it's mostly something that you should avoid. And so, for example, there are studies showing that if you skip any meals, that's associated with living shorter. not long, right?
Mm.
And most people don't know that skipping breakfast is associated clearly with living shorter and lots of more higher cardiovascular disease. And now the argument is even skipping dinner is associated with living shorter and about a doubling of cardiovascular disease. So really, and this is amazing because very few people, even experts in the world, are explaining this, right? The mostly is bad, right? And so people always say, "Oh, but yeah, we knew that fasting could cure diabetes a long time ago." Well, what does it mean? If you fast for a month, of course you're not going to be diabetic at the end of the month, but then your metabolism is going to slow, and then you're going to be diabetic in 2 months, right? And so what's the point of that, right? So yeah, I think that's what the field now is working on, and it's not just me, but there is a small group of scientists that are saying, okay, what kind of fasting exactly is working for whom and how, and what are the mechanisms? Yeah. So I think that for diabetes, for example, it's very clear now. It's trial number 5, pre-diabetes and diabetes. If you do it once a month for 5 days, it will regress in most people, diabetes, and it will result in diabetes-free survival in a percentage of the people within 12 months, right? This is very clear now. And but independent studies, this is not studies sponsored by a company. These are studies initiated by universities, large universities, Heidelberg, Leiden, and USC, my own university, etc. So so now this has been used for the FMD is being used for lots of different things, and and there are a few other fasting that I like and that I contributed to, but people have been doing for a long time, and the only other one is 12 hours, 12 to 13 hours of daily fasting, right? And there's a new paper, I think, coming out of Egypt last week or very recently, indicating that plus calorie restriction is better than calorie restriction alone, right? So I really like that, because most of the studies out there were not looking at the more reasonable, feasible fasting, safer, right? So it's safe. Every doctor in the world will say 12 hours. Great, and but now we're starting to see efficacy. I put it in my book, but I never got around doing studies, clinical studies on it. And so now it was great that this group in Egypt did it, and and it showed the results. So I think that's the future, right? FMD and 12-hour daily fasting, and FMD not once a month. I think the future is FMD every 3, 4, 6 months, right? So could you just do a fasting mimicking diet for 5 days every 3 months? Now we have the data, 500 people in southern Italy, very large study. I cannot talk about the results, but that's what we did, right? A fasting mimicking diet only once every 3 months. Or a fasting mimicking diet plus what I call the longevity diet. So every day, very guided type of nutritional, regimen.
And that's certainly what I've been doing every 12 weeks or so, a 5-day fasting mimicking diet, which we'll talk a little bit more about. And then, yes, I've settled on that 12 to 13. And I was fascinating listening to you on Rangan Chatterjee's show, just talking about some of the stress responses in longer fasting. What I would say is that some of my patients still struggle with that 12 hours, that metabolic flexibility, the ability for the body, just to move into a bit of ketones after a few hours. I was doing that with the Bristol University medical students and watching them, develop ketones much quicker than me. And I think, that's a very interesting element as well about aging and how that kind of ability to be metabolically flexible might reduce over as we age. I don't know if that's the case, but certainly I've felt that I've been reclaiming that ability to move between those two things. Shall we say a little bit about the fasting mimicking diet, these 5 days? And I obviously know them very well, what it involves, but I just wondered if you might talk to us about the science and maybe nutritional ketosis when that kicks in, which is a bit variable, but then this idea of autophagy, because this seems really important in terms of cell repair and health and longevity.
Yes. So, so the idea that behind the fasting mimicking diet was, first of all, mimic fasting, right? But allow the patient to eat. They came from a failure with cancer patients back in, I think, 2011 or so. We started a trial with water only fasting. It was a big failure. We did not expect it. We thought cancer patients are going to be motivated, but that's not the case. They felt cheated, and the oncologist kind of agreed with them. So then the fasting mimicking diet has to mimic fasting, and we usually use 4 markers: IGF-1, IGF-PP1, ketone bodies, and glucose. Right? Those are the 4 markers that we for whose changes we look for in determining is the fasting mimicking diet actually equivalent or very similar in efficacy to water-only fasting. So it is. It takes about a day longer for FMD to get where the water-only fasting gets to, but it's much safer. And the fasting mimicking diet was also combining, and I think it was a really good idea that I had back then. I said, what is the healthiest what I call the longevity diet, right? Let's just let me take the healthiest ingredients that I can possibly think of, thinking about Okinawa and, Loma Linda, California, and Sardinia, and all these places where people live a long time, and then say, okay, let's make it only with those longevity ingredients, right? And, so that turned out to be a good idea, because even if you do it once every 2 or 3 months, now it's 5 days of an opportunity to have a vegan diet, super healthy, right? So I wasn't really thinking about that so much, but now maybe it was instinct, but now I'm thinking great, because now, also, beside the fasting mimicking effect, is also giving people an opportunity, and the microbiota, right? An opportunity to adjust to this really healthy set of ingredients. So most people don't eat vegan, and these really healthy ingredients like nuts and green vegetables and beans and so now, so there's 5 days of an opportunity to do that. So yes, microbiota changes temporarily, but also training you to understand. And now we're starting for the first time with children 14 to 18 in Campania, one of the worst obesity areas of Europe. So we're saying, is it possible that the child, the teenager, will be trained, the nervous system will be trained to adapt to this, very healthy diet. And so, so then lots of different benefits. And then, why 5 days? Well, because if you go shorter, we suspect that we're not going to get the ketone bodies and lots of the effects that the autophagy, et cetera, and that we should get. And then if we go longer, we felt it was not feasible, number one, and number two, potentially allowing you or pushing you to enter this thrifty mode, where you're now you're trying to save energy, right? And so most people don't realize that, even experts. So there's clear studies by Label and others at Columbia many years ago showing, and this is also known for calorie restriction, if you starve people long enough, they will enter this hypometabolic, low energy expenditure mode. And it may be that they're locked epigenetically in that mode for a long time, potentially years, right? And this is why, I was listening to one of the Venus sisters, recently, and she was saying, well, I felt like, I had to eat and go back to my old weight. Well, this is, if you don't unlock that, that's what the brain is telling you. You have to return. If you lost 10 pounds, you have to regain 10 pounds, because that steady state is where we want to return to, right? So you don't want to enter that, because if you enter that, then you got a problem.
Absolutely. And what I've noticed is that I haven't put the weight back on, that this incremental weight loss, doing it every 12 weeks or so. What's fascinating to me, having watched myself just put on weight, is it's like that the body's reset at that lower weight. And I think the science behind that reset and our basal metabolic rate. You know, I am a devotee of the FMD. And again, we talked previously, didn't we, when we met, about the way it can be beautifully put into research. You know, it's reproducible. It's the same thing happening to each person. And I get very frustrated with the weight loss jabs. I'm thinking, gosh, why can't we, just do the FMD? Because again, with the children you're working with, it seems that if you can fast for 5 days, you seem to be healthier the rest of the time. Is that right? Even if people are eating a fairly free diet.
Yeah, and this we have shown for mice and published it. This was actually a Nature Metabolism paper, 2021. So we took the mice, and now I'm talking about the mice, but we have the same data for humans, right? So when we took the mice, it was really shocking to see, because we took the mice, we give them the worst Western diet that you can think of: high fat, high calorie, high sugar. We put it all in there, ultra processed, name it, and then we give them one group just got that, and they became big. And they, high cholesterol, heart problems, all the issues that you will expect from a human being. And then we did 5 days a month of the fasting mimicking diet, and just let them lifelong be on that bad diet. And we thought we're probably going to get like something in between, but we didn't. We got it canceled out all the problems, right? And we were very surprised, yeah. And so this is a university study, nothing to do with the company. I mean, that's what we got, right? And so I think that's what we see in people, that the worse the diet they have and they maintain, the bigger the effects that we see. Now, so somebody is on a perfect diet, an athlete, 32-year-old, and you see some effects, but it's not easy to see. But if somebody's on a really bad diet, that's where we really see a complete change. And that's why we see diabetes regression, pre-diabetes regression, et cetera, et cetera. Now, about mechanisms, right? So now there's a publication about to come out from Cedars-Sinai here in Los Angeles on autophagy. And apparently autophagy is happening at the end of day 5, right? It's right before you refeed. That's when autophagy happens. Before that, as other papers have suggested, I think Guido Kromer had looked at it, you don't see autophagy. Even day 4, you still don't see autophagy. So I think we got that right spot. And then, really the biggest thing is this shrinking re-expansion process, which now very clearly in mice and rats, and now we're starting to see initial evidence in humans, it's turning on stem cells, is turning on Yamanaka factors, is so on one side, so you get the autophagy, then you get the let's say bone marrow stem cell activation, and then you get reprogramming in the pancreas, in the kidney, and lots of different places. So what does it mean? It means that these factors that can return somatic cells, differentiated cells, into an embryonic-like state are turned on, drastically. And it's not just the Yamanaka factors. Is lots of different embryonic developmental factors. It's like the tissue is returning to a developmental-like, generation modality, right? And this is why I think is so powerful, because it activates all these different things. And now, for example, we did a pilot study, a small study with chronic kidney patients at the University of Rome, which was published. And in the rats, we shown that we could severely damage the kidney of the rat. And then we started the fasting mimicking diet cycles, and you see the rat transcriptional landscape going back to the normal the normal shape, right? Which is really remarkable. It means that even though we completely damage the kidney irreversibly to some extent, the fasting mimicking diet refeeding put everything back the way it was before, and this is a paper that we just published. But then the kidney patients, in the chronic kidney patients, we now saw something surprising, which was circulating progenitor progenitor and stem cells were tripled, right? The circulating kidney progenitor and stem cells were tripled in number. And so is it possible that now there is the Yamanaka factors, which we didn't yet prove in people, but we did in rats, but also the circulating stem and progenitor cells that are going to the site and doing the job of rebuilding, right? It's speculation, I don't know, but certainly seeing this very high level of these progenitor and stem cells in circulation of these patients was surprising.
It's incredible to see the body's potential for repair. Um, what? Just tell us again, why do you think fasting, it's triggering autophagy, but it feels like it's triggering a deep repair response, almost like a potentiality for new growth or change, like why do you think it's so powerful? And are there other things that are as powerful as that?
Yeah, I think it's so powerful. I always talk about cutting yourself, right? So if you cut yourself within a couple of weeks, there's like almost a perfect repair and regeneration system going on, right? So now you think after 3.5 billion years of evolution, we developed the skin repair and regeneration system, but we haven't developed the liver, the pancreas. It's probably all in there, right? It's probably all in there. So let's say you got wounded, your kidney got wounded by arrow, 25,000 years ago. Maybe fasting was the way, and maybe fasting for a while was the way to help the kidney repair, right? So you got wounded. Maybe they ask you to not eat for a couple weeks. And what if that was the way you repair the kidney before there was medicine, before there was surgery, and lots of other ways to do it. So, well, not lots of other ways, but potentially some ways to do it. So then that's a possibility, right? That we've always had a repair replacement system, but those required fasting and refeeding, right? So the biggest part. So in the aging world, we always talked about, Walford, my boss back in 30 years ago, he talked about calorie restriction, but calorie restriction is actually missing the most important part, which is the refeeding, right? And it is during the refeeding that the rebuilding occurs. So the fasting is just autophagy, break down parts, set the stage, start activating stem cell, activate Yamanaka factors, and be ready then to begin the rebuilding process. That's what it looks like in different organs.
Yeah, amazing. And maybe we'll, just shift into the role of fasting in cancer, because again, what we see is the healthy cells being able to respond to the fasting stimulus, whereas the cancer cells that are more poorly put together, they've been put together fast and not very effectively, are less responsive. But can you talk to us about that? Because that seems a key biological response, doesn't it, that allows fasting to be supportive to the cancer patient and reduce side effects?
Yeah. So this came from old discovery over 20 years ago in my lab in yeast, actually. So we were showing that if a yeast had an oncogene-like mutation, so if it had the type of mutation that characterizes, cancer cells, it did not respond to fasting, right? So it was that those genes, RAS, PI3 kinase, et cetera, those are the ones that were controlling the response to fasting. So if you cannot turn them down because they're always on, you cannot respond to fasting. And so then that came the idea, okay, maybe this is a way to distinguish all cancer cells from all normal cells. So all normal cells respond to fasting, they have to, and all cancer cells don't respond to fasting by definition. That's the definition of a cancer cell. Cancer cell, unresponsive to anti-growth signals and independent of growth signals, right? So I thought, beautiful. This is, maybe the only way to distinguish all cancer cells from all normal cells. And and it worked, right? So it worked. And so you take a mouse, you fast it, and the mouse becomes more protected to chemo, and the cancer cells become more sensitive to chemo, right? So they go exactly in the opposite direction. But then we started doing with kinase inhibitor, hormone therapy, we and many other laboratories, and then immunotherapy, Yeah, so I kept on working, and probably because it allowed, for example, with immunotherapy, we suspect that that may also be a process, a mechanism that is evolved to expose cancer cells to the immune system. Why? Well, you fast, you if you're the immune system, you have a hard time figuring out, well, which one is a cancer cell and which one is a
Mhm.
normal cell, and which one is a precancer cell. Yeah. And so maybe that's the way you test them, right? And so, okay, let me fast you. And then whoever goes in a protective mode, in a G0 stands by, that's a normal cell. And whichever does not do that, then that's something that I should attack, because that's one of the signals that tells me, as a T cell, let's say, that this is a abnormal transformed type of cell, right? So yeah, so I think that also is probably some evolved mechanism to distinguish
So there's
damaged cell.
a double benefit. One is that you protect the healthy cell, but secondarily, you expose the cancer cell to the immune system.
Yeah, and thirdly, you put the cancer cell in trouble, because the cancer cell is stuck in somewhat of a higher metabolic mode than it should have, right? But now the nutrients are limited, right? So now, a lot of cancer cells need a lot of glucose and need a lot of amino acids and need a lot of growth factors. So all of that now becomes lower. And the interesting thing is, some cancer cells we see, they really depend on glucose, and they hate it when we fast them because the glucose go down. Some other cancer cells don't care about glucose at all, right? They care about one glutamine, right? They care about one amino acid. Some other cancer cells care about growth, IGF-1, or some other growth factor. So yeah, so that's the power of fasting. You're lowering so many different things that, on top of the immune system attack, now you have metabolic confusion and metabolic struggle, because one, two, three, maybe 10 different things. So, for example, for hormone therapy, we shown that the cancer cells, so we use hormone therapy plus fasting mimicking diet, and if, with hormone therapy in the mice, the cancer adapted, and they start growing eventually, right? So you're using estrogen blockade and something called CDK4/6 palbociclib. Now, if we had fasting mimicking diet, that you see the cancer going down and then eventually start disappearing, right? But to do that, it was lowering IGF-1, leptin, and insulin signaling, right? So now you will have needed 3 different drugs blocking insulin, IGF-1, and leptin to get the same effects as fasting, and we actually demonstrated in the mice, right? So yeah, it lowered 3 different things, each of which could have allowed the breast cancer to grow. And so, yeah.
Amazing, amazing.
So,
And there's been, lots of concern from oncologists about weight loss, but reading your new book about fasting in cancer, it seems that people can regain the weight when they need to in between the fasting. But I did wonder how long, I'm a cancer doctor. I'm seeing patients on complex regimes that are lasting indefinitely. How long do you think people can go on with the fasting mimicking diet with a cancer diagnosis?
yeah, a long time. I think remember, in Ecuador, there was a lady that had done like 50 cycles or some crazy, for many years, right? And I know of others that have gone years and years and years. So yeah, so we published on women, for example, doing 1 year or so of cycles, and there's not an issue. Usually, what we do within the foundation clinics, we monitor the lean body mass, and and the weight loss, et cetera, et cetera. And then with the oncologist, the decision is made, maybe should skip a cycle, right? Not fast during this cycle, allow more time to regain the weight. And also we like to for example, immunotherapy, we like to alternate and say 1 cycle of immunotherapy without fasting mimicking diet, 1 cycle with, just in case, right? So yes, in mice we see and potentiate the immunotherapy, but what if in this particular patient it was not, and it was interfering? We have no evidence of that, but it's a little bit of paranoia also in handling this. So this is why we don't usually recommend FMD early, like stage 1, the type of patient that is going to get surgery and has got 98% chance of being cured. We usually say, okay, don't, 98% is good. And unless there are severe side effects of the chemo, let's say, the recommendation is usually, wait, let's see what happens, and
So
then, and then we'll do it.
even with someone, say, like with breast cancer, the surgery is likely to remove the tumor, and they're moving into chemo. Are you saying not to fast during the chemotherapy regime?
Yeah, I mean, we did. There was a trial that we did in Leiden, and this had a lot of patients, but they were not very compliant to the FMD. But they just did a few cycles, or and that was it, right? And it was really no difference in overall survival just by doing a couple cycles very early on, and that so I don't think that's the way to make a big difference. Now, this is a very small group of people that did the FMD, and this is like 125 patients, and only 25% did more than 2 cycles. So we don't know, right? But it wasn't like, wow, everybody did the FMD was alive, and everybody didn't do the FMD was not. So with that in mind, I would say that whereas in the metastatic setting, for example, we see, Vernieri published, early studies, but published 2 or 3 papers, and his group in the broad, indicating, differences or big differences in PCR, complete pathologic response, and also in overall survival. So yeah, I think the metastatic triple negative breast cancer, that seems to be definitely any metastatic, right? So any metastatic that is hard to cure. I would say, yeah, definitely, right? Definitely do it, and talk to the oncologist and do it, or your doctor and do it. But yeah, earlier, let's wait and see what the results are. I mean, I think we're gonna need 1,000 patient type of trials, right? To
Yeah.
to
But in terms
to
of
see.
oncology symptom support and reducing side effects, people are wanting to explore the FMD during their chemotherapy because, things like peripheral neuropathy and mucositis and all of those side effects could, potentially, the evidence is suggesting it's beneficial. Is that
Yeah,
right?
yeah.
For
There's some
side
some
effects?
clinical trials. Some clinical trials suggesting improvements in side effects. And yeah, so I think so, right? If that's the case, if there is a side effect, a grade 3, 4 side effect, and yeah, then the FMD should definitely be considered for them. But yeah, we still don't have any solid data indicating that a few cycles, early on are gonna make a difference 5 years later,
Yeah.
and
Yeah.
that's kind of hard to expect, right? It's like it's
Yeah.
possible. It's like magic, that you could do cycles now, and and 5 years from now. I mean, of course, it'd be different if for 5 years you did the FMD, but unfortunately, that's not how the studies are designed, right? You treat it now and then stop, and then maybe these patients have gone through many different therapies, but not involving the FMD, and then you're gonna judge the FMD 5 years earlier. Yeah, so I don't think that the few cycles um, are gonna be magic 5 years later. Yeah.
And I'd love to see big longitudinal studies comparing those that apply an integrative oncology model versus those that don't. I mean, obviously, the public, because it really matters to them how they get on, often they're using things and not discussing it with their oncologists anyway. But I would love to see some studies now. And there are a couple more questions that I want to get in, because one of them is around vitamin C, because, that's always been, since Linus Pauling, he kind of really developed an understanding of vitamin C, but it could never really be applied in cancer treatments effectively, or I couldn't see it. But you were suggesting that there may be qualities of timing and when to apply that vitamin C. Would you be able to say a bit about that?
Yeah, well, first of all, vitamin C, the what's looking promising in the clinic is not the oral, but is the high dose injected vitamin C, right? So you have to get high doses in the system. And then when we did this in mice, like for colorectal cancer, we saw effects, right? And in lots of human cells and mouse cancer cells, but not very much of an effect, right? Until we combine it with the fasting mimicking diet. So vitamin C plus the fasting mimicking diet. Why? Because vitamin C is causing hemoxygenase 1, a gene that it goes up, and then something called ferritin, and ferritin is the gene that scavenges iron, right? So basically, the body, the cancer cell protects itself by turning on the system. Say, okay, I give lots of vitamin C, but the cancer cell turns on the system, it gets rid of iron, and the iron is really central in killing the cancer cells because it causes something called ferroptosis, right? And so so then the fasting mimicking diet lowers the ferritin, re-exposes the cell to lots of iron, and the iron and the oxygen species, collaborate to be very little to the cancer cells. So so then this FMD vitamin C really it's got a lot of potential, but the system is not set up to go and help people with integrative solution. The system is set up for a few pharmaceutical companies to get few drugs through the system, with $200-300 million cost per drug, right? So then the problem is going to be how to prove this in the clinic, when there's going to be very little investments. Nobody wants to invest on vitamin C and fasting mimicking diet. And, so yeah, I think that whether it's UK or Italy or the United States, the governments need to wake up and establish programs that allow things like this to be tested all the way, right? And do they work? And maybe with a deal with the whatever company may be involved, saying, okay, let's make it very reasonable, fairly inexpensive when it gets there. I'll pay for it, but then make it fairly inexpensive if it works, right? So we would love to do that, like FMD plus vitamin C and maybe some other non-toxic drugs for the treatment of lots of cancers. And but if you're lucky, you get a phase 2 trial, and then it stops there and it just disappears because it never has the funds to go all the way to FDA approval.
It's so frustrating, to watch Monjaro just come in and, just be used so regularly. And now we're realizing that people regain the weight. So NCIM are launching their metabolic health program, because what we would love to do is really give people sustainable change, so that they can learn how to cook food, eat good food, have the FMD, learn, 12-hour fasting. And yes, they might use the weight loss drugs, but they're going to need that other support to create sustainability.
A new British study showing that, I think it was British Medical Journal, basically saying people that were on GLP-1 regain more weight than people that lost the weight by dietary means, right? Or exercise. And then I don't know if they were speculating or they demonstrated, but they were saying probably by taking GLP-1, you turn off the normal GLP-1 pathways, and now, once you stop GLP-1, you don't have your natural hunger suppression system, and now you're in trouble, right? You're hungry all the time, and and on top of that, it seems like most of the weight regained is fat versus, so you lose fat and lean mass, but then you only regain the fat. So for a lot of people, it was probably better to never do this, right? Never do it.
Yeah. Yeah.
So so I think that it's just, in a way, these drugs are dumb systems, right? Why? They just block something or activate something. In this case, they activate the GLP-1 receptor. The fasting mimicking diet is triggering what the grizzly bears and the penguins from the South Pole have been doing. And not surprisingly, the grizzly bears, when they lose weight during hibernation, they lose very little lean mass, right? So why? Well, after millions of years of evolution, and in fact billions of years of evolution, because all this started in bacteria, in prokaryotes.
Mm.
Why would you wanna break down lean mass, right? You just wanna break down the fat, and you have a very sophisticated system that breaks down the fat and protects the muscle and the bone density and all of that. But the drug does not have the sophistication. The drug, and then they add another drug, another drug, and they're thinking, oh, okay, now I'm going to give you the drug for muscle, not understanding that the more you interfere with the symphony that is the human body, the more you're going to get in trouble, right? And you're going to show efficacy for 6 months, you're going to get FDA approval, and then 3 years later, guess what? You're going to have a problem, right? So why? Because now you have 3 drugs, each interfering in different ways with the normal physiology. So it's just really, I'm shocked, right? That a lot of doctors are like, oh, GLP-1, and this is great, and I love this. And I'm like, okay, for some people, I agree, right? If somebody is morbidly obese, and you try the FMD, and you try and
Mm.
nothing worked, then minimal use of the GLP-1, I think, is reasonable, and then come in with the FMD and other things and maintain it, like 12 hours time restricted eating. But nobody's doing that. I mean, it's virtually non-existent, right? And it's really shocking.
So I have to bring this fascinating conversation. You can imagine I've got like tons of questions, but I will stop. But I also love that we ended on a symphony, because I was describing to one of my patients the body, like an incredible orchestra, all the different instruments that are somehow brought together in harmony. And I feel like what I've enjoyed about your work in the FMD is it's working with the body's natural genetics, its natural repair mechanisms, rather than, as you say, interfering. And then those multiple drugs, that polypharmacy, causing, chaos really in this incredibly designed, finessed system that's been finessed over, as you say, millions of years. So I'm really grateful, Volta, for your work. It's truly amazing what you've done and how much you've done in a relatively short amount of time. So thank you so
Thank
much.
you. Thank you.
All
Yeah.
right.
And by the way, if you haven't seen it, Stanford just published on the FMD and Crohn's disease. Very beautiful data in Nature Medicine, just came out a couple of days ago.
Makes total sense to me
look at the
because
paper.
it's anti-inflammatory. So, once we understand, how to bring inflammation down, it can help maybe with rheumatoid as well as Crohn's. So I'm excited. I'm going to look at that. Lovely. Thank you so much,
Yeah.
Volta.
Thank you. Thank you.